Good morning, dear student. Today we discussed uh, the topic that is the biochemistry of lithium. So, in last lecture, we will discuss the chemistry of lithium and some points regarding to the biochemistry of lithium. That is, which components of lithium is used to treat the bipolar disorder. So, in this lecture, we will discuss the actual mechanism, so how this lithium component work on this mania and depression. That is how it work on bipolar disorder. The mechanism of lithium, that is action of lithium. The mechanism of lithium action is not well known, but uh, there is a mechanism, so we will discuss this mechanism for this lithium action. So if you consider the lithium is equally distributed inside and outside in cells. That is, lithium is equally distributed between inside and outside nerve cell. So nerve cells are the fundamental units of brain and nervous system. So the first point is that lithium is equally distributed. Lithium is equally distributed inside inside and outside of nerve cells. So you should remember. Then another role of this lithium, that is it moderate the activity of GQ protein receptor. GQ protein receptor. So we are chemistry students, so we are not go into very much details. What is this GQ protein receptor and what is their mechanism? So you should remember only the role of lithium. That is, it is equally distributed in nerve cell. It moderate the activity of GQ protein receptor. And the third important use of this lithium, that is, it inhibits it inhibits IP3 formation. IP3 formation. So what is this IP3? That is inositol triphosphate. It is inositol triphosphate. So this component, it is generally responsible for manic disorder, that is inositol triphosphate. So increase in the activity of inositol triphosphate, which causes the neuron hyperactivity and which is responsible for mania. So you should remember this IP3, that is inositol triphosphate. The spelling, so let us correct the spelling, that is IONO. It is not INO, IONO. Inositol or inositol. Inositol triphosphate. Inositol triphosphate, it is mainly responsible for mania, and this lithium inhibits the formation of inositol triphosphate. So let us discuss the mechanism of lithium to inhibit this inositol triphosphate. So we'll discuss the mechanism. So we discuss the mechanism with the help of diagram. So let us discuss. So if you consider, So this is your GQ protein receptor. This is your GQ protein receptor. So this GQ protein receptor having different subunits, that is alpha, beta, gamma. So they having different subunit such as alpha, beta, gamma. So this alpha subunit, it is shown by a red color. So slightly it is shown by a red color. So this is your alpha subunit. So total three subunit is there: alpha, beta, and gamma. This alpha subunit, when this GQ proton receptor is active, it binds with GDP. It binds with GDP, that is G- GDP, that is your gyno diphosphate, not gyno, it is gynosine diphosphate. So you should remember. So that is when this GQ protein receptor, it has three subunit alpha, beta, gamma. When it is in active form, it binds with GDP, that is guanosine diphosphate. Guanosine diphosphate. So you should remember again. So let us discuss first the diagram. GDP, then it is GTP, guanosine triphosphate. Then this GTP activate the phosphokinase, and this phosphokinase activate this PIP2, this PIP2, that is your phosphatidyl inositol biphosphate. So this is your phosphatidyl inositol biphosphate. So the first is GQ protein receptor, then GDP, guanosine diphosphate, guanosine triphosphate, then phosphokinase, then phosphatidyl inositol biphosphate. This PIP2 dissociate to gives DAG, capital DAG, that is diacetyl glycerol, diacetyl glycerol, and it will gives IP3, that is inositol triphosphate. This inositol triphosphate, it is used, or it is involved in calcium plus 2 mobilization. This IP3 is involved in calcium plus 2 mobilization, that is release of nerve transmitter, release of nerve signal, IP3. And this IP3 gives IP, that is inositol monophosphate. This inositol monophosphate. So let us see the diagram and then we discuss the mechanism in detail. That is IP. It react with inositol, inositol, and regenerate this PIP2, that is phosphatidyl inositol triphosphate. So what is the role of lithium? So in this mechanism, the lithium, it will inhibits lithium inhibits the formation of IP3. Lithium inhibits the formation of IP3. So let us discuss one by one. So this is your nerve cell. So the figure, it is nerve cell. So let us discuss the mechanism of lithium. So first, that is GQ protein receptor, which is when active, having different subunits alpha, beta, gamma. The alpha subunit, when it is active form, it is bind with GDP, that is guanosine diphosphate. As soon as when the ligand bounds to the GQ protein, the guanosine diphosphate dissociate, or it will break the bond between this alpha subunit and this GTP, that is guanosine triphosphate, get binds to the alpha subunit. So the binding of GTP, that is guanosine triphosphate, activate the alpha subunit, and the activation of alpha subunit results into the activation of phosphokinase. So when this GTP binds with your alpha subunit, it will activate the alpha subunit, and this alpha subunit on activation activate this phosphokinase, and this phosphokinase on activation results into the breaking of PIP2, PIP2 and DHE, PIP2 and DHE. So you consider this phosphatidyl inositol biphosphate, it will dissociate into IP3 and diacetyl glycerol. So if you consider this IP3, that is inositol triphosphate, involved in calcium mobilization, that is release of nerve signals. And if you consider what is the role of this lithium, so if you consider this IP3, that is inositol triphosphate, it will gives inositol monophosphate, and this inositol monophosphate react with the inositol present in your cells and to regenerate the phosphatidyl inositol triphosphate, inositol biphosphate. So again there is a formation of IP3, and we know that this formation of IP3, that is inositol triphosphate, results into the mania. And therefore what is the role of lithium? So the lithium inhibits the formation of inositol monophosphate. So no doubt this lithium, it will stop the formation of this inositol monophosphate. So no doubt it inhibits the formation of IP3, but in this mechanism it will stop the formation of inositol monophosphate, and due to this the inositol monophosphate is not involved in further reaction or further cycle to produce PIP2. So this lithium inhibits the formation of this inositol monophosphate, and due to this it is not available for the recycling of PIP2, that is phosphatidyl inositol biphosphate. And again due to the absence of this PIP2, IP3 cannot generate, and this IP3, which is responsible for mania. So this is the role of lithium. So it will not it will inhibits the formation of inositol phosphate, and due to this PIP2 is not formed, and due to this IP3 is not formed, and the patient cannot suffer from mania. So this is the role of lithium. So this is the mechanism, the well known mechanism for lithium action. Actually it is not known, the actual mechanism is not known, but the preferred mechanism for the action of lithium you should understand, that is the GQ protein receptor, then three subunits, then GDP, GTP, that is guanosine diphosphate, guanosine triphosphate, phosphokinase, and then phosphatidyl inositol biphosphate, it will dissociate into ip3 and diacetylglycerol, and this ip3 results into the formation of ip, that is inositol monophosphate, and which results into again pip2. So this lithium inhibits the formation of ip, and finally it inhibits the formation of ip3. So this is the mechanism of lithium. So let us discuss some important points regarding to this lithium. So if you consider the lithium, the weight, the right dose of lithium varies from people to people. That is, the people suffer from bipolar disorder, so you should give a dose of lithium, but the dose quantity is varies from people to people. But if you consider the normal dose range of lithium in case of bipolar disorder, it is from 900 milligram to 1200 milligram per day. So you should remember this value. The normal dose range of lithium in case of bipolar disorder is 900 to 1200 milligram per day. More than, so you should remember, more than 1200 milligram per day is required. More than 1200 milligram per day is required in case of acute bipolar disorder. Acute means in large amount. Bipolar disorder मोठ्या प्रमाणात more than 1200 milligrams per day in case of acute bipolar disorder. Again, the safety, or we can say a safe blood lithium level, a safe blood level of lithium is between 0.6 to 1.2 milli equivalent per liter, milli equivalent per liter. And the toxicity of lithium when this level it is reaches to 1.5 milli equivalent per liter. So you should remember the normal dose range and the normal level of lithium in blood, that is 0.6 to 1.2 milli equivalent per liter, and the toxicity of lithium is occur when the level, that is the level of lithium in blood is reaches up to 1.5 milli equivalent per liter. So let us discuss the toxicity, that is symptoms of lithium toxicity. So when the excess lithium is overdose to a person, so what is the different symptoms? That is the symptoms of lithium toxicity. So if you consider when the dose is mild to moderate, when the dose is mild to moderate, कमीत कमी ते मध्यम प्रमाणात जर दिलेला असेल, माइल्ड टू मॉडरेट, then what are the symptoms of lithium toxicity? Then the first symptoms is, that is the dry mouth. Then if you consider second, that is vomiting, mild to moderate, so dry mouth, vomiting. Then fatigue, thakwa, fatigue. Then stomach pain. Then if you consider the weakening of bones, then frequent urination, frequent urination, because this lithium is removed from body from the urine. Therefore, frequent urination is also one of the symptoms of lithium toxicity. Frequent urination. Then loss or gain. Weight loss or gain. So these are the symptoms, that is dry mouth, vomiting, fatigue, stomach pain, weakening of bones, frequent urination, and weight loss or gain due to the mild or moderate dose of lithium toxicity. So let us discuss when excess lithium, that is the symptoms of overdose of lithium. So let us consider the overdose of lithium, that is the toxicity when overdose of lithium is given. Overdose of lithium. So what are the symptoms? Toxicity or overdose of lithium. So the first symptoms, that is agitation, then kidney failure, agitation, kidney failure. Third, rapid heartbeat, rapid heartbeat. First agitation, second kidney failure, third rapid heartbeat. Then most next one, that is uncontrollable eye movements, uncontrollable eye movements. Again, low blood pressure, low blood pressure. Then confusion, and due to the high toxicity of lithium, the person goes into coma. So coma, it is also a severe toxicity when there is a excess lithium is given to a person. And the last, that is the death. So you should remember these symptoms are regarding to the excess toxicity of lithium or excess dose of overdose of lithium. So this is regarding to the biochemistry of lithium. So we will discuss the chemistry of lithium, then the biochemistry of lithium, its distribution, that is generally its distribution in blood, that is zero point 0.6 to 1.2 milliequivalent per liter. Again, the normal dose for people, that is 900 to 1200 milligrams per liter, that is 900 to 1200 ppm. So milligrams per liter is nothing but the ppm. And again, if you consider the isotopes we already discussed, that is lithium has two isotopes naturally occurring lithium, that is lithium 6 and lithium 7. So this lithium 7 contribute 92.5%, and this 6 lithium contribute remaining 7.5%. So whenever a lithium is there, it is a mixture of 6 lithium and 7 lithium, but the major part is 7 lithium, and the smaller part is 6 lithium. So these two isotopes are used in case of bipolar disorder. So this is regarding to the biomedical use of lithium. So in next lecture we will discuss the next topic of our course, that is uh, the anti-cancer agent cisplatin and its derivative. Thank you.